Welcome to the discussion series called Pillars of Fitness. This is going to be a 5-part topic that is going to cover various aspects of strength, cardiovascular conditioning, body composition, flexibility and range of motion, all those leading to the 5th component of balance. Today our topic of focus is going to be on strength. We're going to be discussing the anatomical features that allow us to actually physically have strength. We're going to be talking also about how we can go about developing a strength training program, as well as some helpful information about certain exercises that are traditionally overlooked and how we can try to incorporate them throughout our given day. My name is Craig Cole, and I'm going to be your presenter for our Pillars of Fitness series. And just to give you a quick rundown as to my background, while I was in college, I earned my personal training certification through the American College of Sports Medicine. Now, ACSM is looked at in the industry as a gold standard for the science and application in regards to fitness. But then shortly after I had earned my certification, I went on to earn my bachelor's degree in exercise biology, which is now more commonly known as exercise physiology. Shortly after graduating college, I received my certification in exercise medicine, which allows me to work with individuals, doctors a little bit more, so patients can have a better outcome status for any health-related fitness programs. I'm also certified through the Aquatic Exercise Association for the Arthritis Foundation Aquatic Program. And I also received my certification through Rock Steady Boxing for those that have Parkinson's. I've worked with individuals with Parkinson's for roughly around 15 years now, and I received this certification as to basically bring a more energetic and lively and functional type of fitness program to those fighting Parkinson's disease. Again, I welcome everybody for this presentation, and I hope that you all gain a lot of knowledge from it and enjoy. Strength is an aspect in man that has always been looked at with reverence. We look at athletes on the playing field, and the strongest ones always capture the attention. Or we look at things in pop culture with superheroes and the strength and how they are standing up for the righteous well-being of others. But when it comes to actually defining strength and its practical application, we need to understand that muscular strength is the ability of a muscle or a muscle group to generate enough force against a resistance to allow it to move. Now, as you can see within the picture, we have a man who is pushing a very large boulder up a hill. That boulder itself weighs a tremendous amount of weight. It is taking a lot of muscle recruitment to generate enough strength to get that boulder to move. Now, in turn, if we were sitting there trying to take a feather and push it up the hill, it doesn't require as much strength because the resistance against his muscle tissue is not there. So in definition, our strength requires us to be able to have where our muscles exert a force against a heavy resistance. When we look at a breakdown of muscle tissue, we're going to notice that it's composed of a number of individual fibers that are bundled together in something called a fascicle. These fascicles basically contain anywhere between 15 to 150 fibers per bundle. And this is important because the higher number of fibers that are available is going to basically elicit greater force and strength during the contraction of a muscle. Now, our larger, stronger muscles will contain more muscle fibers in the fascicles than our smaller, weaker muscles. The muscle fibers usually contain thousands of myofibrils that are arranged in a regular pattern. And they're arranged in a regular pattern because if they weren't and our muscle went to contract, we'd have an irregular contraction that would occur. Within all the myofibrils are something called myofilaments that do allow for this contraction. And within these myofilaments, we have different types of filaments, such as our thin filament, which is called our actin, and our thick filament, which is our myosin. In this slide, we're going to be taking a closer look at the actual breakdown of a muscle belly itself. Now, as you can see, it looks like a progressive step down from size relation, from the muscle belly through the different structures, from the fascicle, the muscle fibers, down to the myofibril. Now, what we're going to be looking at, and I'm going to highlight real quick the fascicle element right here. This guy right here is where the fascicle is, the bundle of muscle fibers. Now within all the muscle fibers we have hundreds of them that are sitting there within the fascicle, depending again upon the muscle type. But within all the muscle fibers we have a number of myofibrils which are present within that aspect of the tissue. And within these myofibrils we have these little striations, and I'm going to try to use my little highlighter here to mark where those are at. And these little striations that we'll see within the myofibril are actually something called sarcomeres. And sarcomeres are what contain the actin and myosin filament. And again, these are the contractile elements that essentially force the muscle to contract once stimulated and generate the force and strength required for certain movements. We'll be talking about the actin and myosin filaments and the sarcomere in just a moment. As was mentioned in our previous slide, we're going to be talking a little bit more about the contractile filaments, actin and myosin, that allow for a muscle to contract or in some cases relax. As we look at our diagram here of the filaments, you're going to see something called a Z-disc. And a Z-disc, I'm going to highlight this here real quick. I'll highlight it in yellow. The Z-disc is an area that acts as an attachment point for our actin filaments. And this is very important because if this Z-disc was not present and the actin filaments began to contract, they would just pull needlessly and there would be no contraction. So what ends up happening is our sarcomeres, which are the full length between Z-disc to Z-disc, are contractile units that contract when stimulated by a nerve signal. And it's important because our sarcomeres run in parallel to the muscle fiber. If they did not run in parallel, we would have an abnormal contraction which would cause no force to be generated. So when we look at the actual physiology of contraction, the myosin heads interact with the actin chains, pulling the actin chains towards each other. And this creates a cross bridge effect that generates either a shortening or elongation of the sarcomere length depending on the situation of the muscle. If the actin chain is pulled together, events occur that allows the muscle belly to contract, creating strength and force of movement. It's important to understand that there's an overlap that occurs between the actin and myosin filaments. The amount of initial overlap of the myofilaments is important because this dictates how much strength and force can actually be generated. If there's very little overlap, a reduced amount of force is developed. If there's too much initial overlap, again, the amount of force that can be generated is reduced because there's very little ability for the muscle to further contract. A muscle does have an optimal amount of overlap that maximizes the amount of force, and this usually occurs when the muscle is in a normal resting position. It's one of those things where you kind of liken it to the Goldilocks and the Three Bears. If it's too hot, the muscle won't contract. If it's too cold, the muscle won't contract with enough force. It's got to be just right at that resting position for enough force to be generated to maximize the muscle's potential. Now that we understand a little bit more about the physiology of muscle tissue, what are the components that make up the ability for a muscle to contract, we're going to be talking about actually what drives the contraction in the first place. Within our brain, we have our premotor and then motor cortex, which are considered to be our higher command centers. Our higher command centers send a nerve impulse that's relayed to our brainstem and then spinal cord, and both of these are considered to be our lower command centers. The high command center relays an appropriate amount of motor unit activation to our lower command centers. And basically what this is doing, this is our brain signaling to our muscle tissue how many fibers are needed to be recruited to generate a specific amount of force. Now the motor unit is actually a functional unit of the neuromuscular system, and it's made up of a motor neuron and muscle fiber it innervates. Now, motor units can actually innervate one muscle fiber, or it can innervate hundreds of muscle fibers. It just depends on what the muscle's primary role within our body really is and how it is fully utilized. Now, the motor unit activation allows for a specific amount of muscle fibers to contract. And like I was saying, that could be one or that could be many. It just depends on what the brain is calling for from that specific muscle. Now, the motor unit allows for the muscle to contract with enough force to perform a desired activity. And this is important because this is a subconscious effect. We're not consciously aware of how many fibers we're having to sit there and recruit to perform a specific action. Once our muscles signal to our brain that, hey, we need to have more help, more fiber recruitment, the brain sends a signal through our spinal cord and our brainstem to the motor units to draw on more muscle fibers to be recruited to generate more force, which allows us to have more strength within our movements. As I had mentioned in the previous slide regarding motor units and how they actually innervate with muscle fibers, we're going to be talking a little bit further about what motor units do within our muscle and how it actually helps us drive a certain contraction. Now, we have something called our size principle, and the size principle is the amount of motor units that are activated and the amount of voluntary force that can be generated by a muscle. Now, the force generation comes from the amount of motor units that are recruited for the task. So when a muscle is activated initially, the first motor units that are recruited are smaller, weaker ones. If they do not move the muscle against the resistance, progressively larger motor units are recruited, which strengthens the muscle's contraction. This essentially is how we get the concept of strength when it comes to moving certain types of objects. Now, our muscles require information, and we get that through something called feedback mechanisms that come from our tendons, but then also from the muscle belly itself, which gives us a sense of whether the force that we're generating is actually creating any type of movement. Now, we have something called motor unit thresholds, and these are the number of fibers that come in contact with a motor unit, the motor neuron. And we have a couple of different types. We have our lower threshold, but then also higher threshold. Our low threshold units have lower numbers of fibers that come in contact with the motor neurons and vice versa. Our higher threshold have a greater number of fibers that come in contact. Now, our motor units actually have different types to them. We have our type 1 units and type 2, but the type 2 is further broken down into type 2A and type 2B. Now, it's important to understand, and I don't want to create any confusion with this, but we also know that our muscle fibers come in various types as well. And the muscle fiber types get their designation from the types of motor units that innervate with them. Now that we know a little bit more about our motor units and how they innervate with our muscle tissue itself and into the various muscle fibers, we're going to be talking a little bit more about the muscle fiber types themselves. Our type 1 fibers are fatigue resistant, and they're also a little bit more aerobic in nature. This means that they're a little bit more beneficial for endurance-based cardio movements such as jogging or skiing. Traditionally, they're a little bit more red in coloration, so if you look at an anatomical picture of muscle tissue, you're going to see it again, that little bit more red coloration of them. Our type 2 muscle fibers are important for strength and power movements. Now, our type 2 fibers are further broken down into the type A or type 2X. Now, the type 2A fibers are primarily for strength and power movements, but then do offer some level of endurance for several minutes upon initiation of activity. The type 2A muscle fibers are a little bit more anaerobic and aerobic in nature, which means that they can use oxygen or work without oxygen as well. Our type 2X fibers offer strength and power for movements, but usually derive their energy sources from the muscle itself, meaning that they're purely anaerobic by nature. Now, the number of motor units that are attached to the muscle are not always the same amongst all people. A skeletal muscle isn't just purely one fiber type. Our genetics definitely play a role in this type of muscle fiber distribution. Now, it's important to know that when it comes to muscle fibers and their ability to contract, we have to understand that the central nervous system can increase the strength of a muscle contraction by increasing the number of active motor units and increasing the firing rate of those motor units. This helps out with respective muscle fibers to create greater tension, which helps us drive greater strength. This is something that can actually be trained, which is why strength training is such an important component of everyday fitness. Now that we've discussed the different physiological characteristics that are within a muscle, such as the fascicles, which house the muscle fibers, and how the muscle fibers house the sarcomeres, which contract and relax, we're going to be talking about the force that is generated by these various contractions. And it's important to understand that actin and myosin interaction is the key driver here. It's very important. We have a sliding filament theory, and a sliding filament theory is when the nerve signal is sent to a muscle fiber, and the actin slides over the myosin chain, causing the sarcomeres to shorten. Due to this shortening, a contraction is created and force is generated. There's a catch to all of this though. Now, force generated depends on the number of active sites on actin that the myosin chain attaches to, and this creates a cross-bridge generation. The sarcomere length itself dictates the strength of the contraction. Now, the length of a muscle dictates the amount of force that can be generated for activities such as running, jumping, and also strength training. Now, with the sarcomere at rest at essentially normal length, it can generate maximal force. If the sarcomere is overstretched, little to no tension is actually created. And if it is overcontracted, it's near its peak contraction, there's a reduction in the amount of force that can be further generated. So if we think about our bicep muscle for just a second, we have it where if the muscle is at normal resting length and it's just hanging down by our side, if we go and pick up an object that has some heft to it, we can contract and we can generate force, which is going to allow our forearm to move, bring our hand up to the front of our shoulder. This is where we can generate maximal force. Now, if we have that same arm hanging down to our side, but then all of a sudden we have it pulled back behind our body, the bicep muscle itself will become stretched, and it's going to be harder for force to be created from this position. Now, if we take our hand and we bring it all the way up to our shoulder, contracting our bicep muscle, we now already have it where that muscle is under almost full contraction. Because it's under full contraction, we can't generate any further force. We can't create it so it can move anymore. So therefore, no more force can be generated. And that is why it's very important that we understand how our actin and myosin filaments respond with one another and at what lengths they are, so that we can generate the most force possible in a given circumstance. So going from the concept of generating force, which is the overall strength of a muscle contraction, we'll be talking about power now. And power of a muscle is its ability to exert a force in as short a period of time as possible. This is important for key aspects such as running, jumping, and throwing, for example. Now, the amount of power that can be generated from muscle tissue stems from a concept of force-velocity relationship. And this is where that aspect of force times the velocity of movement actually creates muscle power itself. The generated force is dependent upon the number of actin and myosin cross bridges that form. Because we want a good cohesion between the myosin and the actin filaments, time is a very important thing for the development of these cross bridges. The more time results in more cross bridges being formed, giving us more contractile force. If a muscle contracts too quickly, the actin will actually slide over the myosin, reducing the attachment points. So if we look at our graph to the right of our force and velocity curve, you'll see various things such as maximal strength, strength-speed relationship, generation of peak power, speed and strength, and then maximal velocity. So the overall concept is this. At zero velocity on our x-axis, if we look at the y-axis, which is our force, the maximal force is created at zero velocity. At max velocity of movement, zero force is then created. Our central nervous system helps us elicit the appropriate amount of power for a specific activity. For more specialized movements, It's important to know that training for power really does come into play. So we can take it where we can train for both force and velocity generation. So we think about things from a strength training standpoint. Strength movements that have higher loads usually result in less velocity of movement. So if we think about somebody doing a back squat with a barbell across their back with a heavy load on there, when they squat down, they're not going to be able to move very quickly on the return back upright. Now, if in return that load is lighter, they'll be able to drop down into a squat and then rise back up relatively quickly due to that reduced load. So the reduced speed, if we think back to the heavier barbell, the reduced speed actually allows for more force to be generated because more cross bridges are being created. Again, we allow more time for those connections to be made. So for strength movements, such as that lighter weight on the barbell, the strength movements with lighter loads result in more velocity of movement, which reduces the amount of force generated for the muscle action. And again, that's because less cross bridges are being created. This whole entire concept gives us the various intensities of exercise. So again, our training can actually let us work on strength and power development or speed and power development. And the different training intensities are very important because it gives you a very good cross-training effect. The reason why strength is definitely one of our pillars of fitness is because of the plethora of benefits that are associated with it. We understand that strength training helps increase our lean muscle tissue, can help improve our body composition, and that means that we can actually, while we're putting on that lean muscle tissue, we can actually help reduce down some of the fat that may be on our frames due to the increased utilization of fat to help fuel our muscles during workouts. It helps strengthen up our connective tissues such as our tendons, ligaments, and our muscle. It helps improve our glucose levels, which glucose levels are improved due to better utilization of glycogen stores in the body during anaerobic metabolism. We can have it where our blood pressure becomes reduced. We can have it where we improve or even treat to an extent metabolic syndrome such as type 2 diabetes. We can increase our strength, power, and anaerobic endurance. And the anaerobic endurance is when our muscles function during periods of reduced oxygenation. We can increase our overall bone mineral density, which is important for those that have osteopenia or osteoporosis, which is the demineralization of bone, making it more brittle. All these different types of benefits that just come purely from strength training are one of the reasons why it is definitely a pillar of fitness. Whenever I've had a client or patient come to me and ask about working on a strength training program, I've always taken the approach of looking at it like a puzzle. When it comes to strength, there's so many different facets that go along with it that we're always trying to look at what the client's or patient's goals ultimately are. What are we trying to develop based upon their needs or their desires? I generally recommend everybody to look at what the purpose of intent is behind your strength training. Ultimately, we want everybody to be as strong as they possibly can. Once you try to meet your physical requirements for what your daily activities are, but then there are also individuals out there that want to try to supersede what those daily limits are. They want to try to be more active within certain sports or certain activities, going out and playing with the grandkids, you name it. But you always want to make sure when you're doing a strength training program, you have some kind of purpose or intent that goes behind it. So if we're looking at strength prescription, you always want to look at it like a doctor giving you a recommendation for medication. It's going to have some type of benefit that's going to help you out long term, not just in the short term. So the whole entire idea with this is we want to make sure that, again, our purpose of intent is clearly defined before we get started on that program. So if we look at some purposes and examples here, if we're looking at the idea of having increased strength, if we look at it from a practical application, say you've been having some challenges lifting yourself up from a chair to stand up. Strength training for your lower body, your abdominal muscles, your lower back are going to help you be able to rise up from a chair. If you want to have strength training for weight loss, This is important because lean muscle tissue helps you control and regulate your glucose in your system a little bit better, which can help you control your diabetes. We can also have strength training help out with increased muscle endurance. And this can help us reduce our shortness of breath when we have any type of movement that results in our muscles being able to contract, which results in increased force generation. We can also use strength training to increase our mobility. Believe it or not, strength training is a great way to go and force a muscle to go through its range of motion to stretch. This can actually help decrease pain across our joints and again improve that overall range of motion. Most importantly, we can actually use strength training to help improve our balance. The stronger that we can keep our muscles, the better in tune we have them to react to a certain stimulus, we can actually help reduce the likelihood of having a fall. It's a key important note to remember to always have a pre-activity screening with a health or fitness professional. So if you have any concerns about getting started on a strength training program, it's important to go and talk with your doctor. Or if you do not have any types of major medical issues that are of pertinency, you can actually go and talk with a fitness professional, go through a pre-exercise assessment. That way your exercise professional can understand how they can help guide you a little bit better and give you better feedback on how, again, you can develop that strength prescription. So let's say you've gone through the pre-activity screening, everything came out good, your doctor's on board with you being involved in a strength training program, your trainer got a great plan set up for you. Well, now it's time to continue on with the whole concept of the exercise prescription, the strength prescription. You as an individual need to understand that strength doesn't happen overnight. Strength development takes time, it takes patience, and it also takes quite a bit of effort, believe it or not. But when you do invest yourself into a good strength training program, the benefits, the feeling of satisfaction, they're endless. You just overall feel better about yourself, and you are then definitely going to be able to accomplish a lot more. But there are some variables within the program that you can definitely control. And what we need to understand is that all these different variables really are based upon the level of fitness of the participant. Okay, so we need to determine the type of exercises and the equipment that are going to be used. And it's always important when you get yourself started on any type of strength training program to really emphasize multi-joint movements versus isolation-based movements. So when we're talking about multi-joint versus isolation-based movements or single joint, a multi-joint movement is an aspect of, let's say, a bench press. Okay, we have it where the muscles in our shoulder, our elbow, and our wrist are all involved to help strengthen the pectoral muscles in our chest, the muscles in our shoulders, our biceps, our triceps, our forearm flexors and extensors. Okay. Now, a single joint movement is something just like a bicep curl. You know, you're sitting there, you have your arm hanging down your side, you've got a weight in your hand, and you bring your hand up to the front of your shoulder. The only muscle that's truly being affected at that point in time is directly your bicep. Very little other muscle is having a direct involvement. Another variable of control is the order of exercise that we go through. A recommendation that I always make to individuals is think about what your most challenging exercise is first and try to accomplish that first while your body has peak energy. If you start off with your best movement first, by the time you get to your weakest one, you're not going to have enough energy left to help bring and boost that weaker exercise up. And we always want to try to make sure that we have a nice balance between all of the muscles within our body. So I definitely recommend starting out with your weakest exercise first and then finishing off with your best one as the last exercise. It's important to always determine the number of sets, repetitions, but then also your tempo or your speed of movement. We're going to talk a little bit more about the sets and repetitions and what those actually mean and how they elicit certain effects within our body. So I won't talk about those just yet. We also need to make sure that we plan out our rest periods between our sets and also our exercises. Generally speaking, if we're looking to put on lean muscle tissue, we want to try to have about 30 to 45 seconds of rest in between our sets. And this is just enough time that we can have where our muscles become reoxygenated, adenosine triphosphate, ATP stores start to become a little bit more replenished in our muscles, allowing us to have enough energy to accomplish that next set. Now, when it comes between your different exercises, generally it's recommended to get anywhere between 1 minute to 2 minutes of rest in between an exercise. And this is just basically almost enough time that you get yourself set up for that next movement. This allows you to have maximal energy stores replenished within your muscle tissue that you can actually perform that next movement with better efficiency. But then it's something that you also need to understand too is planning for the intensity of the exercise. And the intensity of the exercise is basically what kind of effort you're going to be putting into your movement. And like I was saying, when it comes to strength development, it's going to take effort. And that effort, it's going to make you a little bit uncomfortable. And you want to feel a little bit of discomfort when it comes to strength training. You want to feel your muscles go under load. You want to feel it where your heart rate increases, your blood pressure increases, your breathing rate increases. You want to feel like you're starting to sweat as you progress through your strength training workout. You need to make sure that you are prepared mentally for that, not just physically. Your muscles are going to sometimes last a little bit longer than your mental state will. And it's very important that you plan ahead, get yourself prepared for your exercise session. That way you can put your heart and your soul into your strength training workout. Now on the slide here, I actually have what's called our FIT prescription for strength training. And this strength training, guys, is actually for recommendations for older adults. And the graphic here that I have is a recreation from the American College of Sports Medicine's Guidelines for Exercise Testing and Prescription. And this is a great resource manual for exercise professionals. It's almost like a fitness Bible, if you will, that goes through all of the clinical testing and knowledge that we know that we can apply to different aspects of fitness. But what we're going to be highlighting here is the aspects of resistance training through the frequency, intensity, time, and type. And when it comes to the number of times that you are doing a strength training workout, you want to have a base minimum of at least 2 days a week. If you can get in more than 2 days a week of strength training, you're going to notice the benefits much quicker than you will if you do the base minimum. The amount of intensity, and again we're just talking about the intensity on the previous slide, is we want to have it where if you're doing the light intensity, you want to do that if you are a beginner into strength training. And that's where we want to try to hit 40 to 50% of our 1 repetition max. And our 1 repetition max is the maximal amount of weight that we can do within 1 repetition. So again, if we're using a squat, for example, if you have a barbell across your back, what's the amount of weight that you can do just 1 time before your body says, I can't do anymore? And once we get that number, we take 40 to 50% of that, and that is what we're going to consider to be our light intensity. We can then progress to moderate to vigorous intensity, which is usually 60 to 80% of our 1 repetition max. Now we can also change it where we can alternate between moderate to vigorous intensity, and we can use a RPE scale, rate of perceived exertion. And a rate of perceived exertion scale ranges from 0 to 10. For moderate intensity, we want to have on that scale 5 to 6, and for vigorous, 7 to 8. Now, a moderate intensity on the RPE scale is where you're recognizing that the movement itself is mildly challenging. You're not fully overexerting yourself, but then it's not where it's at the point where it feels too easy. You know that you're lifting something. For our vigorous, our 7 to 8, that is where we really understand that we're putting a lot more effort into our movement, and the resistance itself is much more challenging. You're getting to the point where you're going through about 6 to 8 repetitions and you're nearing muscle fatigue. The amount of time that we put into our strength training workouts, it can vary, and depends again on what your goal is. Traditionally, we're trying to look for an accomplishment of 8 to 10 exercises involving all of our major muscle groups. And those are the muscles that are within our chest, our upper back, our abdominal area, our hip, our thighs, our lower legs. We want to try to maximize all those various muscle groups during an exercise session. But we also want to make sure that within all of those exercises, we're trying to accomplish anywhere between 1 to 3 sets of usually 8 to 12 repetitions each. And that 8 to 12 repetition scheme is usually very good for strength and also hypertrophy training. Now, the type of exercise that we do with our weight training is we want to try to have where we're using progressive weight training programs or weight-bearing calisthenics such as stair climbing and other strength activities that utilize all of our major muscle groups. So again, if you are getting started on a introductory strength training program, we don't want to have it where you're sitting there hoisting a barbell over your head that's got 135 pounds on it, or you're sitting there, arm curling, 55 pounds on a dumbbell. There's no need for that. We need to understand that you want to start out at what I call a cautionary standpoint, and usually it's sometimes even below that 40 to 50% of intensity, because it's more important to understand how you're performing the movement than it is actually doing the movement. You need to understand how your muscles are going to respond. You're going to have to teach your muscles how to actually go through the right, correct range of motion for every single exercise, and getting this mind-body connection set up. Then as you start getting a little bit more adept at the exercise itself, you can start working on increasing the resistance. You can increase the number of sets, the number of repetitions, and also your time under tension. But again, those are all things that you can work on progressing through using the FIT protocol. So what goes hand in hand with the FIT protocol is aspects of volume and progression. So the volume and progression should recur regardless of your age or your overall physical condition. And the volume and progression are areas that will help you start out at a baseline and then work your way up to whatever your goal essentially is from a strength training standpoint, or whatever you're trying to do from an activity standpoint. The volume is something that consists of our sets, repetitions, and resistance used. The progression consists of an overload of resistance or the overall volume itself. So when we talk about progression, we're going to be talking about progression overload. Progression overload is where, as you consistently go through your strength training workout sessions, you're going to constantly be trying to challenge yourself. So instead of staying at the same consistent weight, the same consistent sets and repetitions, you're going to start getting to the point where you're going to start increasing your volume, sets, repetitions, and resistance. When you do this, you're trying to stimulate your muscles to develop new growth and a new hormonal response that allows you to generate more strength. And this is something that you can continue to progress on. And the graphic to the right of the young man who's sitting there carrying the young calf, as the calf ages, it becomes larger, but he's sitting there carrying that calf every day until it turns into a full bull. And as you can see, the young man starts out very slender and not much muscle on him, but by the time that bull reaches full growth, the young man has turned into a very strong physical specimen because he's progressively every day worked on carrying a heavier load day after day. Now, it's important to know that various studies have actually demonstrated that it takes about 16 sessions or more of a strength training workout to start to see any significant gains in muscle strength or even hypertrophy for that matter. And this is why during the initial phases of a strength training program, it's very important to remain patient and keep a strong will. Because after you get through the initial 16 sessions of a workout, you're going to start noticing that your strength is going to start going through the roof. You're going to start noticing that your muscular endurance is going to increase. And you're going to find yourselves being able to do different activities that you may not have been able to do previously. I had mentioned in a couple of slides earlier that we were going to be talking about how there are some different sets and rep schemes that elicited different attributes within muscles. And we finally have reached that slide. So what we're going to be talking about right now is what builds strength, endurance, power, and hypertrophy. For muscle strength, we're usually trying to look at about 2 to 3 sets of 3 to 5 repetitions. And when it comes to developing strength, we want to try to maximize the amount of load and also the amount of time that we're putting our muscles under. So this is where we want to try to use heavier resistances to generate strength. For our muscle endurance, this is where this can be a number of sets. We can do anywhere between 2 to 4, even 5 sets in a time. But what we're trying to do is we're trying to use a lighter load with higher repetitions that are greater than 15. And as we talked about, muscle tissue works under an anaerobic state. So what ends up happening is we're having reduced oxygen that is being flown to those muscles, and they're having to use different energy sources to be able to elicit contractions. So for our muscle endurance, we want to try to push the envelope and increase the number of repetitions as much as possible. For muscle hypertrophy, to really get those muscles to grow and develop and become a little bit more dense, we want to have it where we're trying to work about 2 to 4 sets for anywhere between 8 to 12 repetitions. And sometimes that 8 to 12 repetitions, you can also find a balance of strength in there as well. Now, it's not going to get you near your maximal strength like the 3 to 5 repetitions will, but it will still be a balance between strength, but then also muscle building. Now, for muscle power is an interesting thing because we want to try to do as little repetitions as possible for a reduced number of sets, because what we're going to try to do is we're going to try to generate maximal force with also maximal velocity. We're going to kind of create a little bit of a bridge between the two. And this is where we're going to be trying to work on having where our muscles react to a certain stimulus as fast as possible. And again, this is good for getting yourselves up out of a chair. This is good for anybody who's trying to throw a baseball. This is good for anybody that's trying to jump or sprint. Anything that's going to require you to move faster. Now we're going through and we've talked about exercise prescription, how our muscles are made, what they consist of, but now we're going to be talking about some very important exercises to perform essentially while we age. Now, some good movements that we can really start to look at are the sit-to-stand movements, which elicit the response from our gluteal muscles, our hamstrings, our quadriceps, our lower lumbar area, as well as our abdominal area. And it's very important to understand that with the sit-to-stand, you don't want to have it where your heels are out ahead of your knees. You can't generate any leverage that way, and it makes it very, very challenging, but then also somewhat dangerous because you don't have it where you can keep your center of mass over top of your feet, your points of contact off the ground. For wall push-ups are a very friendly way to help strengthen up the muscles in your arms, your shoulders, your upper back, and your chest. With wall push-ups, you can place your hands against the wall, keep your hands about the height of your shoulders, and then slowly start taking your feet and walking backwards until you put your body on a little bit of an incline. Once you have your body in this position, you're going to try to keep a straight line from your shoulders through your hip all the way down to your ankles. And you're going to let it be where your heels slightly come up off the floor. Slowly, you're going to bring your chest towards the wall, making sure, of course, not to let your nose smack into the wall itself. And then under control, using the strength in your upper body to push yourself away, bring yourself back to your origination point. In order to keep our arms strong, that's when arm curls and tricep extensions come into play. For our arm curls, this is where we're going to be isolating our biceps, and for tricep extensions, we're going to be isolating just that, our triceps. Now in the pictures that are provided, we have the traditional dumbbell curl, and then we have a depiction for our triceps of what's called a tricep kickback. Now a tricep kickback is where you're holding your elbow elevated and you're basically extending your forearm behind your body, almost like if you're using a hammer to nail a nail into wood. But both of these movements are very good for helping develop and strengthen up the muscles of our upper arm. Now for the supinated grip band pull apart. I know that sounds like a mouthful, but basically what that is actually using a resistance band to help strengthen up the muscles in the shoulders as well as the upper back. What ends up happening with this is you have it where your hands are about shoulder width apart with your palms up and you're grasping a hold of a resistance band. What you're going to do with this is keeping your arms straight, pull your arms apart as wide as possible, contracting the muscles in your shoulder and your upper back. This is a good exercise to do to help reaffirm the posture for your upper back. Some other important exercises that we're going to be looking at are heel and toe raises. And the picture that we have for this is a great little observation on lifting those heels up as high as possible. And then again, you can see the individual, they're holding onto a desk. You can hold onto a wall, you can hold onto a chair, essentially any stable surface. But when we lift our heels up, we're going to keep our toes on the ground and we're going to be pushing through our calf muscles. Now when we bring our heels down, we can then rock back on our heels, lifting our toes up off the floor. Now it's very important that when you're doing this, that you want to try to keep your body as vertical as possible. When you lift up onto your toes, you want to take your head, drive it straight up to the ceiling. When you rock back on your heels, lifting your toes up off the floor, you want to make sure that your hip does not drop back, forcing your center of mass, aka your belly button, to go off center of your heels, which will cause you to become unstable. We could go into some seated rows for our upper back, and seated rows can be done either from a sitting or standing posture. For our purposes, we're going to be talking about aspects of rowing from a seated position. And what you can do is you can take a band, if that's what you have available, and you can put it underneath the arches of your shoes. Sitting up nice and tall with good posture with your arms fully extended, you're going to focus on driving your elbows back behind your body, squeezing your shoulder blades together in what's called a scapular retraction. And this is where we're going to get to be where the latissimus dorsi, our rhomboids, our teres minor, teres major, and some of the rotator cuff muscles all contract and squeeze to initiate this pulling movement. Then you slowly release your hands back out, fully elongating your arms, and then go back through and repeat. Another exercise that is a good one to do is something called hip bridging. And hip bridging can be something that you do on a floor or quite honestly even in a chair. For our purposes, for demonstration aspects, we're going to be talking about being on the floor. You can even quite honestly do this in bed for all intents and purposes. But what you do is you're laying on your back and you're going to take your heels, you're going to pull them back towards your hip, which is going to elevate your knees into the air. You're going to keep your shoulders down and your heels down. But one key aspect with hip bridging is you want to make sure your toes are elevated up. We want to have it where we're maximizing the strength in our glutes and our hamstrings. If we have a tendency to have our toes down on the ground, we're going to get a little bit more activation out of more of our hamstrings and our quadriceps than we will essentially our glutes. So kind of going back into it with the heels down and the toes up. When your hip is down on the floor, you're going to focus on taking your pelvis and driving it up towards the ceiling. When you do this, you're going to get a very good contraction out of your gluteal muscles. This is a translational movement for our sit to stand because again, if you can have it where your hip and your glutes are strong, it's going to be a very good benefit to help you lift your hip up out of a chair for any type of sit to stand based movement. Now, some safety notes that we need to understand when it comes to strength training. We need to always make sure that we're taking due time to learn how to properly execute the exercise. We don't ever want to just jump into an exercise and perform it incorrectly, because that's what can actually lead to injury to either our muscles or also even our connective tissue, our tendons. We always want to make sure that we listen to our body. If we feel like we're pushing too hard and you feel like you're doing a little bit too much in the way of exertion, it's okay to back off and readjust the resistance that you're using, readjust the sets or repetitions that you're using. It's also an opportunity to make sure you go back again and make sure you're performing the exercise correctly. If it hurts, stop doing it. Another thing is to make sure that you are patient. I already talked about that in a previous slide. But again, we need to make sure that we understand that it takes about 16 or more workouts to really elicit any gains worthwhile in terms of muscle hypertrophy or even strength gains during the initial stages of any type of resistance training workout. The strength will come, but you need to make sure that you put your work and effort into it to make sure that it happens. If an exercise hurts or you don't feel like it's getting you much benefit, modify up the exercise. And you can do this on an as-needed basis, and it's always a good idea to make sure you talk with an exercise professional to get some insight on how you can take a specific movement and modify it up with another movement that is still going to target strength of a particular muscle group. And there's a variety of different exercises that are out there. I mean, there's more than you can count in a lifetime. But all movements do one thing, and that is they force a particular muscle to contract. Now, it's always important to understand that sometimes an exercise movement, some have certain risk factors that go along with it, and you need to make sure you use best judgment when it comes to that. When it comes to strength training too, something that happens a lot, especially when you start getting into individuals that are using heavier loads or they're basically maxing out their muscle endurance, is they have a tendency to hold their breath. Please, please, please never ever hold your breath while you're exercising, especially when it comes to strength training. A good rule of thumb is to make sure that you're breathing out on the positive portion of a movement and inhaling on the negative portion of a movement. So if you are doing a bench press, for example, you're laying on your back, you've got the barbell above your chest. When you bring that barbell down towards your chest, you're going to breathe in, you're going to inhale. When you press up bar away, you're going to exhale or breathe out on that positive portion of the movement. And this is just a great way to, one, control the tempo of your movement. It's another great thing to help increase the oxygenation of your working muscles instead of letting them become fatigued out. It's always a good idea too to work out with an exercise partner. And this is a person that can help you do spotting techniques. They can help you watch your form. They can help you get equipment as necessary. They're also a person that can help hold you accountable, and you can do the exact same for that partner as well. And it's just always a good idea because it helps you, quite honestly, have more fun with your strength training workout. Plus, it also helps you be a little bit more accountable for what you're doing. Something else to keep in mind too is, remember, you control the movement. The movement never ever controls you. If you ever get to the point where you're starting to lose control of the movement, you start running into a very dangerous territory. And that's when you can either drop the weight, or you can have it where a joint or muscle happens to give out on you because you've lost control of it, and you can cause injury to yourself. You always want to make sure that you are remaining in control during your whole entire workout session. The other big thing is always take time to ask questions and get feedback on your form. Even if you're working out by yourself, ask for advice, ask for feedback, ask for somebody to watch you. It's also important to note too that if a movement ever hurts beyond mild discomfort, quite honestly, you may be doing too much. And sometimes that's this thing that can happen during the initial stages of any type of strength training workout. If it's something that you experience pain during a workout session and you come back in for another workout session and you're still experiencing that pain, quite honestly, it may be time to go and talk with your doctor to go through a quick checkup let your doctor know what it is that you've been doing exactly. Show them what your actual exercise prescription is, and that way they can have a better understanding as to actually what may have happened to have caused a certain injury to you and how they can help you onto that road of recovery. So in conclusion, strength training is incredibly beneficial, and that's honestly regardless of age. You can start working out when you are a preteen, between like the ages of 11 and 12, and you can do that safely. You can work out throughout your whole entire young and middle age adulthood. But the thing is too, you can still work out and strength train even as an older, mature adult. We can still get strength training benefits, quite honestly, into our mid to late 90s, believe it or not. We can still develop that strength and that lean muscle tissue. It's always a good idea that if you're getting yourself started out on any type of exercise program, don't necessarily go and jump into looking at magazines and newspaper articles that way, because those usually have a tendency to cater to a group that already understands the nuances that go behind a particular strength training exercise. Always talk with an exercise professional, and even talk with your primary care physician if there's specific goals that you want to work on. And this way you can start learning how to go through strength training safely. And you can have it where your strength training becomes very purposeful to you. It's always a good idea to develop a very strong mind and body connection, which is going to help you with your activities of daily living, and that's the ADL's moniker there for short. Certain tasks will always require less effort as your muscles learn to work more efficiently. And that is very important, that if you are, say you're trying to lift up a dog cage, for example, and you're trying to move it so you can sleep underneath of it. It's one of those things where you want to make sure you have the strength, you can actually move that with very little effort so you don't end up straining a muscle in your lower back, for example. And the key note on this all too is to make sure that, again, if you have any questions or concerns about starting any type of resistance training, or if you do have any medical issues, such as issues with high blood pressure or diabetes, or you do have a history of previous arthritis or tendonitis, that you do talk with your doctor about that. That way they can make recommendations on where you could start out at, or who you could even talk to about getting yourself on a good strength training program. I would like to thank you all for taking the time to join me for this first in the series of Pillars of Fitness. Please join me next time when we talk about cardiovascular conditioning and what that means for our heart and our lungs and the rest of our body. Thanks a lot. Let's talk to you next time.